what kind of telemedicine can be incorporated
Yeah.
in?
So, yeah. Um, Anybody who has congestive heart failure needs really ongoing care. You cannot just say, I'll see you in a year, or take an aspirin and I'll call me a year later. You can't. It has to be a constant, it's a lifestyle. We call it TLC, therapeutic lifestyle change, in which you have to do a lot of changes, and you have to follow the lot of parameters like Mr. Bobra has just said. So, what do we do with our patients once they get discharged? The first thing we do is to make sure that we have a telephone conversation with them within a week. I give all the CHF patients my cell number because I don't want them decompensating and showing up in the emergency room. I tell them my goal here is to keep you out of the emergency room and out of the hospital. So please watch your diet. Please be compliant with your medicines. If your medicines are getting over, call the doctor a week in advance. Don't call me to say I ran out of it yesterday. And if every single day they have to keep their blood pressure, their pulse, their weight, there's a record that we actually have a congestive heart failure documentation that they take with them. That's a very standard document from ACCHA. You can get it. So they do it and they learn that if their body weight every morning without clothes, same time, they go and weigh themselves. If their body weight is more than 4 pounds in 2 days, or 4 pounds, actually, I tell them 4 pounds in one day. If your weight has changed more than 4 to 5 pounds in one day, I want a call that day, not tomorrow, not day after. Because what that usually indicates is not that they have eaten too much, but that they are now retaining water. So I train them, watch for signs of congestive heart failure. If you now cannot lay flat, I need to know. If your legs are swelling more than normal, I need to know. If you have too much bloating, because people don't realize that bloating is not because they ate some bad food. Bloating is because they have water retention, not only outside in the body, but also in their gut. And when that happens, they get bloated, they get full earlier, so they're not eating, they don't get nourishment, and then when they take their medicines, it doesn't absorb. So at that point, they need to come in and get IV medicines so that they can absorb it. So the main things are measure your parameters at home. Now, talking about, and then they go to cardiac rehab. Everybody who's been revascularized goes through cardiac rehab. It is one of the best services provided by Medicare, is that they agree for the 36 sessions of cardiac rehab, where they learn to exercise and improve not the entire cardiovascular functional status. So even the peripheral muscles, when you exercise, you're going to flush out the, you have more circulation, the lactic acid accumulates, your vessels dilate. So everything improves, the vascular tone improves with exercise. So they go for cardiac rehabilitation after revascularization or a heart attack. Now, what you said about heart rate variability is phenomenal, Yoginder. There was a paper in the 1990s, I think it was 97, 96, 97. This article came out, and it's a brilliant article on heart rate variability in patients with congestive heart failure. And it is an individual prognostic indicator of long-term mortality. So if a person has very good heart rate variability, which means they are sitting down, they are 50 beats a minute. They get up, it is 56. They take a deep breath, it slows down. They breathe faster, it goes out. So with the respiratory function and with your functioning, the heart is able to slow down or improve or increase the rate. So it's the variability, the beat to beat variability. People who have heart rate variability, and if you're measuring it, it's phenomenal, Yoginder, because that is an single most individual prognosticator. We don't use it enough in cardiology, we just don't. But it is a beautiful indicator. If somebody does not have heart rate variability, it's a bad sign. It's a bad sign, and they have high morbidity and they have low life expectancy, and high mortality. So heart rate variability is brilliant. And since this is the CWC, I am, if I may take a minute, very important. One of the things that you can do to improve your heart rate variability, you can go about it the Indian way, or you can go about it the I'm in the Silicon Valley, I need a gadget way. It's up to you, whatever floats your boat, do it. There is a thing called pranayam. If you do pranayam and you learn to do breath control, you actually decrease your sympathetic tone, and you increase your parasympathetic tone, and your heart rate variability improves. You can make your heart beat faster or slower just by breath control. It is a real science, and there is scientific evidence for this. So you can find a good yogic guru and learn how to do pranayam. And if you want, you can go, there is a place somewhere in the Silicon Valley, it's called Heart Math, like mathematics. You go to Heart Math, they make you sit in front of monitors, they hook you up, and they train you to modulate your heart rate, your blood pressure, your rhythm, and everything. So people who have all kinds of palpitations and things, with heart math, with objective biofeedback, can actually improve their heart rate variability.